Please welcome Dr. McCullough. Thank you for being here, Peter.
Thank you, Dr. Drew.
So let's kind of start with, by the way, good job on Fox Business yesterday. I thought that was excellent, that they gave you kind of the time to talk about things a little bit, because people are suddenly interested in so many of the things that you and I have been talking about and worrying about and trying to solve for quite some time. So bring us kind of up to, go ahead, please go.
Yeah, it's true. The interest in this cabinet position, there's 15 cabinet positions, Secretary of HHS. Do you remember any deliberations over Alex Azar or Xavier Becerra?
No. Not only that, I challenge anybody to give me the name of a Surgeon General before they went into office that you had an opinion about, or even knew the name of a Surgeon General or an HHS Secretary before Inauguration Day, let alone well after they took office.
So true. I mean, many think back to Luther Terry, 1964. He wrote the Surgeon General report on smoking. Remember, doctors advertised cigarettes with nurses, and doctors strongly supported smoking for over 20 years before that report came in. And then, of course, C. Everett Koop, who brought in the new era of pediatric ICUs and all the things that are done now to prevent childhood injuries.
Well, the one that jumped out all of a sudden early in her, who actually is a wonderful person and quite a good professional, that jumped out early in her tenure. Again, no one had an opinion about her before she was appointed, but Joycelyn Elders, if you remember, she had a bunch of controversy for speaking a little frankly about teenage sexuality, and she ended up being really mistreated, frankly. But let's get off the Surgeon General. Let's get on to COVID a bit. Let's start with bringing people up to date with some of the interventions, some of the, since we last spoke, it's probably been 8 or 10 months since we last spoke on this program, and what you're seeing, how you're thinking about vaccine injury, COVID injury has evolved.
Let's take COVID first. There still are sporadic cases, and Drew, I was reminded what a severe illness this is. I just had a patient die of COVID-19. Now, the history is that she's a few years older than me, and she never had COVID before. I had checked the antibodies, no antibodies against the SARS-CoV-2 nucleocapsid or spike protein, but she was developing scleroderma and systemic sclerosis after taking the Janssen vaccine. We didn't know if it was related or not. Temporally it was. And she had seen specialists and had received rituximab, methotrexate, as well as hydroxychloroquine. And sure enough, she came down with acute COVID-19. And we had started ivermectin. She had started McCullough protocol promptly. And you know what? She died in 24 hours of essentially a viral sepsis. She initially had a fever, and then she developed hypothermia. And recall, a very low temperature in the setting of an infection is an ominous sign.
And so I'm guessing some of those immune suppressives that she was taking for the scleroderma may be the responsible, and she was older, maybe the responsible party. That is so sad. Did anybody attempt to get monoclonal antibodies in her? Because, my God, that works so well.
They work so well. They're currently not available. She was in a rural Texas location. They did the best they could, but, I went through the whole scenario with a surviving husband. And by the time she came in, fever and then hypotension, hypothermia, before you know it, they were doing CPR and there was no chance. It was that fulminant. So I want to remind people that there's estimated about 3% of Americans have still not yet had COVID. Those are the people who still could have severe disease.
Yeah, I during the pandemic, or late in the hours of the pandemic, the tocilizumab had some utility in patients like this because a lot of this overwhelming immune response is the so-called cytokine storm. But who knows? You know what I mean? Sometimes the body just can't withstand this, particularly if you're monkeying with the immune system with very powerful medication.
It's true. I had examined her multiple times. She was so frail. And recall in scleroderma, systemic sclerosis, the skin on the body gets very tight. and there's a form of restrictive lung disease. She had the effects on her hands. And in that scenario, even a bacterial pneumonia, like a pneumococcal or Haemophilus influenza pneumonia, could be fatal as well. So remember the theme here, Dr. Drew, is that in the setting of COVID, it was the frail and those who are particularly at risk for death of other pneumonias that indeed died of COVID.
Right. And they get the scleroderma patients get pulmonary hypertension, and God knows what that did to maybe she had diffuse clotting or something. Who the hell knows? I mean, it's a whole thing. Well, okay. So no one ever said, at least not you or me, ever said COVID wasn't a severe illness. We wondered how severe for people who were young, which generally without risk factors, it tends to be quite mild and still is, even though, and particularly as we've gone through the incarnations of the new variants. I personally am gravely concerned about the continued sort of the various sporadic mandates that are out there for young people to get them to go to school and to go to college and whatnot. And when there is only risk, even though, yes, this is a severe illness and it hits an elderly patient with scleroderma and can kill them, it doesn't mean a 22-year-old is at risk of that. And giving them a product that we know in that age group in particular causes myocarditis, pericarditis, I don't understand why we're still pushing that. And it sort of also brings up the other point. I'll let you talk at length about both these issues. Why we still demand we use the vaccines that produce the spike protein. Why we aren't using whole viral alternatives. I'll let you, or going after nuclear capsid or something else other than the pathogenic protein.
So many good points. One theme that applies to both the illness and the vaccine is what's called risk stratification, right? Not everybody is at equal risk. And, those principles were never applied by our public health agencies and even not by schools or other institutions. Risk stratification is very important for the illness. I do think Dr. Jay Bhattacharya and the authors of the Great Barrington Declaration were right, that we really needed to take special protections for the seniors. And so those of us who had loved ones in congregate living facilities, nursing homes, and other types of institutions, those were, that's where the mortality was. About 40% of the deaths came from nursing homes. Whereas young, robust college kids and kids in K through 12, if they were healthy, they largely breezed right through it. So we should have actually had a differential approach to the viral infection based on risk. And the same thing is true with the vaccines. Vaccines are interesting. They're just the opposite of the illness. While the illness strikes severe disease in the elderly and frail, the vaccines seem to disproportionately hit young and healthy people with serious side effects like myocarditis.
I was working through something. I believe you wrote this large encyclical on the spike protein and what can be done about it, that the TWC is going to be hopefully pushing out pretty soon, because it really is. It's quite sweeping in its information. There's a lot there for people, and I think it's accessible for people the way it's written. What have we learned?
I have to show
and
you,
again,
Dr.
the question.
Joe, I have to show you my model. I have a spike protein model. So this is the virus. Let me see if I can bring it in here. Here we go.
No, it's over there, other way, towards your tie. There you go.
There it is. So hard on camera. Yeah. Okay. So this is a model of the virus, and on the surface are these little spikes. That's called the spike protein. That's where all the damage is done from the virus. The ball itself, the nucleocapsid, is benign. And humans get like 4 different types of these coronaviruses without the dangerous spike protein. This was engineered in the Wuhan Institute of Virology. The spike protein was, and now even the CIA is out this week coming to their conclusion. The spike protein has 2 segments, the outer S1 segment and the inner S2 segment. And what you need to know is the spike protein is retained in the body after the infection, and then it's loaded into the body with genetic production of the spike protein from the Pfizer and Moderna, as well as Janssen vaccines. The Novavax vaccine is a set amount of the spike protein given to the body. So the Novavax vaccine is very different than the others. So you mentioned about differences in risks in the vaccine. That's another aspect of the vaccine campaign that our public health officials have really disappointed Americans.
It's been weird. It's been so weird to me. And there's also, now I know there's a little bit of concern about this vaccine, but I also have people that have been advocating for it, which is Covaxin, which is a whole viral alternative, and that we have these alternatives. And you would think that public health would be interested in helping doctors provide informed consents to their patient. So let's say I had let's take kind of a on the fence case, a 55-year-old female who's obese with diabetes. What if I were to go, you have to take the Moderna, you have to take the Moderna? That is not informed consent. I would have to go, look, the Novavax provides spike protein. It it does have some of the same side effects as the Moderna and the Pfizer. Moderna is higher concentration, more virus. I've seen lots of bad side effects from both. It turns your body into a spike. I mean, we'd have to sit down for 10 minutes and talk about the risk benefits of each of these vaccines. And yet what people get is, take the vaccine. It's just so crazy to me. And Francis Collins, as you mentioned a few minutes ago, that the public health monolith that it has been did not help these things. Yep, Lisa Murray, we're talking about Novavax. That's one of the things we're suggesting. But that they didn't take risk reward into account at all. And Francis Collins is on the record saying that they did not consider. To me, that is malpractice doesn't begin to sort of to incorporate what I think of doctors that don't take risk reward into analysis. I remember when I was training internists, that was sort of my number uno issue. Like, why are you making these choices? What are the risks and benefits? And what's your backup plan? And and never, we just have to do something, ever, ever, ever. That was the worst thing I ever heard from young physicians. I had to do something. It's how you harm people. But they had to do this uber alles. They had to stop this virus no matter what destruction they wrought, and they brought it. And then now the same question is in my mind as it pertains to the vaccine. Why pushing so hard on these two when there are at least two other alternatives? And certainly Novavax's been around. Is it still around? I heard some rumor that it might come off. Yeah.
No, it's still around. So just quickly on the safety rundown, I think there's enough papers to make these conclusions. The most dangerous was Moderna, the original ones, which had 100 micrograms of messenger RNA. Then next was Pfizer at 30 micrograms of messenger RNA. The Janssen vaccine came in third. Now, that presented special risks. It's nearly identical to the AstraZeneca vaccine used elsewhere, and the risks were more thrombotic, blood clots. And then the safest vaccine was always Novavax in the United States, and as you pointed out, Covishield or the inactivated vaccines used elsewhere. Now, Senator Rand Paul broke the news, Dr. Drew, of why Pfizer Moderna is preferentially promoted by public health agencies, and it is, by the way. Our DHS advertises it. Actually, our government does Pfizer's commercials for them on TV. It's because Pfizer Moderna used this same PR firm, Weber Shandwick. And Weber Shandwick has an installed vaccine promotional unit within the CDC Center in Atlanta. And Rand Paul found out about this and wrote Rochelle Lewinsky and said, what is this? You can't have in a sense, a biopharmaceutical promotion unit within a government agency. And that's exactly what's gone on. So our CDC has wrongfully, presented just two possibilities and not fairly described the entire formulary.
Oh, my lights just went out. That'll get fixed in a second by my crack wife producer. There she goes. I do want to point out. Oh gosh, it triggered my train of thought.
Well, it was I did it, Dr. Drew. I cast some darkness on your show with that. But it turns out that our CDC had a contract with Weber Shandwick and was paying Weber Shandwick money in order for them to promote the vaccines internally at the CDC, specifically Pfizer and Moderna.
I do believe that people like you and I should model making apologies where we get things wrong and wherever we do. I'm always looking for opportunities to apologize. I apologized to Naomi Wolf when I got some of the stuff wrong about the the impact of the vaccine on women's organs, women's reproductive organs. And it occurs to me, this is another chance for me to apologize. I did not know the CDC was so adulterated. I didn't know Dr. Fauci had been compromised. And I, early in the pandemic, was saying, just listen to the CDC, listen to Dr. Fauci, they'll get us through this. I've always listened to those guys. They've helped me through my whole career. I was wrong. I apologize. I absolutely apologize. But I want to go back to the manufacturing of the virus itself. I saw someone who had privy to some of the investigational research at the CIA and also through the House, through the Congress. And it looks like that there is a much more problematic piece of the history of that virus. I don't know this to be true, but there are people saying this on the record, that the next sort of curtain to be pulled back, or the next card to be overturned, is that the Wuhan Institute of Virology was testing a virus that we manufactured in North Carolina. It was actually our virus that they had some bats that we wanted them to use to test our virus, but our participation in the manufacture of these furin cleavage sites and these particular elements in the virus, our hands may be dirtier than we know. More to be revealed.
Yeah, that's my understanding of it. And the key go-between between the University of North Carolina, Chapel Hill, and Wuhan was Peter Daszak. Wow. He was the leader of EcoHealth Alliance. He's now banned from HHS programs. Yeah, and so Peter Daszak played a key role, but it looks like the virus, Dr. Drew, the virus was also worked on in the Rocky Mountain Research Laboratory in Hamilton, Montana.
Interesting.
That's run by the National Institute of Allergy Immunology branch. And in a 2018 paper, they had primordial SARS-CoV-2, and they were trying to get it to pass from bat to bat. They were testing Egyptian fruit bats, and this is in a peer-reviewed publication. And so investigative author Jim Haslam has actually published a book about this, about how the virus was actually in multiple locations as teams were working on it.
Well, that brings me to my next question, Dr. McCullough. Are you supportive of onesies? Are you supportive of onesies? I need to know. Do you support these onesies?
What's a onesie?
What's a onesie, Susan says? You like babies, the things that babies use.
I love onesies.
Just what
I don't think we
I'm
heard
trying
you.
to say today is
Here it
you're
is.
really
Here it is.
pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid.
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
Yeah, that was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science, and I want to protect.
But you
Look at Megyn Kelly behind. Megyn Kelly back there laughing her ass off.
Today is.
Oh, there we go. So,
How could you not laugh?
did we lose Dr. McCullough, Caleb? Goodness, did we cut him off because of Bernie Sanders? There we are. You're back. But this was part of the circus yesterday in the RFK hearings. It really is a sort of a signature moment of the desperation that some of these folks were clawing to, were grabbing at, and he, as with many others who were attacking RFK Jr., are accepting millions of dollars from pharmaceutical companies. And this is exactly why RFK needs to be in that position, to tease apart all these adulterating influences, whether it's money to campaigns, whether it's a promise of jobs to FDA officials, whatever it is, journals being supported by pharmaceutical companies. This must be undone.
I agree. You know, vaccines represent about, way less than 1% of healthcare. And, DHS, the Health and Human Services, has 17 reporting sub-agencies. So it's the regulatory agencies, the research agencies, the administration of Medicare and Medicaid, the Public Health Service, and the list goes on and on. And to focus on onesies from the Children's Health Defense. I mean, some parents choose not to have their children undergo vaccination. Historically, that rate's about 2.5%. But I have to tell you, post-pandemic, multiple sources of data, including a paper by Mawson, just published in the journal Science, Public Health Policy and Law, for Medicaid recipients, that rate of being unvaccinated by age 9 is about 10%.
Interesting. Do you have the clips, Caleb? I'm not sure if it's in your list of clips, and I apologize for this, where RFK Jr. actually comes out and accuses people on the senatorial panel of having adverse influence of pharmaceuticals. Is that one of the?
All right, let me see if I can find it.
Maybe it's the. Yeah, it's
but
not
Dr.
important. It's just he. Yeah.
Dr. Drew, I was going to say, I think the most obvious example is when Elizabeth Warren was trying to get Robert F. Kennedy to promise that he wouldn't sue drug companies.
Yeah, he does have that one. Here it is.
She's the
You're going
biggest
to take money
recipient
from
of the
drug
money.
companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh, yeah, I'm
You're the
happy
one-
to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this
I don't
question.
think any of them want to give me money, by the
Right.
way.
Let's keep going.
Right. I mean, there was plenty of opportunity for humor because the whole thing was.
Humorous.
Yeah, I mean, I'm trying to think of the right word. I mean, bizarre comes to mind, but it was farce. It was farcical.
Well, I would use the word unhinged.
Yes.
While Elizabeth Warren was trying to get Robert F. Kennedy to promise that he wouldn't go after drug companies, it was all over social media that she's one of the top recipients of drug company lobbyist money. So this is out there, and I wonder, does she think we don't know?
Well, as Aaron Cariotti keeps asking, do they think we're stupid? That's what I keep. That's sort of the thought bubble over my head. So, as you look at the RFK hearings, how do you look forward to? First of all, how do you assess his performance, and secondly, what do you look forward to in terms of him in that office?
Well, I'm a doctor like you, Dr. Drew, so I always observe people, and I do think Robert F. Kennedy, he looks tired. He does look worn out through this entire process. You can imagine the type of stress and the preparation that he's undergone. In fact, some of the questions we're asking him about detailed operational procedures in these agencies. And there's just no way that he's going to know this. One of the senators asked him about, how does CMS enforce EMTALA rules or something like this? And there's just no way. I knew the answer as a doctor, but Kennedy is not. I think he's doing well. He clearly is, letting the senators essentially make their sound bites for their lobbyists. That's what the senators are doing. And then they answer a question. They ask a question, and a word gets out of his mouth, and then they jump all over him. And I can tell you, I've been an expert in many high-level federal cases. I've testified in the Senate and the House, and so I'm experienced on the side of answering questions. And if I was in Kennedy's shoes, I tend to keep the answers short. And on these very long compound questions, you can always figure out they're looking for a yes or no and just say the opposite. So, for instance, if they said, and Kennedy, you said things against vaccines. You're an anti-vaxxer. Is it true you're an anti-vaxxer? And then he could say something like this. I don't quite agree with that. And then they have to ask themselves, are they going to ask the question why? And if they ask the question why, then they open the door, and then he can exposit. And so, I think he has to use some of those tools. Here's another one on these yes/no questions. I asked you a yes/no question. He can say, yes, and here's the reason why. Or yes, and let me explain. And then when they don't let him explain, then he can just be quiet, and it becomes obvious they are simply grandstanding and not trying to examine him.
Let's hear this. This looks hysterical.
Yeah.
You're not going to take money from drug companies in.
When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
When did you decide to stop beating your wife, Senator? Like, that's the fallacy.
Right, exactly.
It's the age-old fallacy
Right.
that no one can use that in court because it's the dumbest argument ever.
Senator, I agree with President
Right.
Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Let me see. It was on December 23rd at 11:27. That is precisely when I decided I'm going to do that. It's too much. They've got to be.
Is that what you would say?
Well,
I don't know.
It's not just Dr. Drew. It's not just Robert F. Kennedy. When Kim Biondi was up there, who was confirmed as Attorney General,
Pam Bondi.
they wanted the exact conditions upon which she would resign.
Yeah.
Now, how can you possibly know a resignation scenario? So these senators.
I saw them do that. They did that to Kash Patel today too. I watched a couple minutes of that, and it was the same thing. If you were being ordered to do something that you ethically and his response was kind of good. He said, "I will always follow the law," and they tried to get him by saying, "What if they ask you to do something illegal?" It's like, I told you I'm going to follow the law. I'm not going to do something illegal. Hang on a second. Here's somebody, what do they call these things, Susan?
Super chat?
Super chat. Why was Congress exempt from jab mandates? But I would lose my job after 20 years. Congressional Democrats just want the soundbite. Yes, they do. But makes them morons. All right. Thus saith, let's see what his name was. I'm sorry. We got to take a little break here. That is from DV8, Mr. 2. Thank you for that. We're going to take a little break here. Dr. Peter McCullough with us. Where primarily do you want people to go, Dr. McCullough?
Well, let's say you started out with, I think, probably the cardiac arrest of Damar Hamlin. Let's update on the cardiovascular issues that you brought up at the start.
I do want to do that. I want to do a little bit on clotting and stuff too. How about if people want to see more of your stuff, is the Substack the best place to go, or the website?
Yeah, everyone should sign up for Courageous Discourse Substack. Get a free email every day. We've got all the graphical abstracts, the citations. It's very evidence-based and solid. Courageous Discourse Substack.
Very good. We
Did
will.
Damar Hamlin play this season? I don't even know if I saw him.
Yeah.
He did, I believe. We'll start with Damar Hamlin.
Football, and I don't
We'll
know.
start with that, and we'll just go a couple minute breaks here. We'll be right back with Peter McCullough, and then Stephanie Van Watson, the veterinarian who isolated Fatty 15. Be right back. Wellness Company knows that taking charge of your family's healthcare is a top priority, and being rationally ready, and who knows what the future will hold for us. Now, TWC has a service to cover your family's medical needs, including and especially prevention. For just $100 a month, the One Wellness Elite membership includes 2 free medical-grade nutraceuticals per month, free prescriptions for over 800 of the most common medications, access to concierge telemedicine, available at a moment's notice, and a 15% discount on all supplements and the emergency kits. 15% off the emergency kits. That's quite a saving. So if you're spending $100 or more on supplements and meds every month, this plan will already save you money. If you sign up for a year, you'll save $200. And when you use the link, drdrew.com/TWC, you'll get 10% off the first payment to the One Wellness Elite membership. Check out One Wellness at drdrew.com/TWC and get 10% off your first payment. drdrew.com/TWC. It's all there.
That's brilliant. And thank you, Drew. Where's Dr. Drew? Where is he? Dr. Drew. Dr. Drew.
And if you cannot remember the last time you slept a full night or you didn't feel stressed during the day, think about CB Distillery. It's CBD from CB Distillery. People can't stop raving about their natural solutions for sleep. Even Susan took it last night. It slept great. Check out some of their 48,000 five-star reviews saying things like the best sleep I've gotten in years, and I wake up feeling refreshed and ready to go. And it's not just sleep. They have plant-based solutions to help with stress, mood, focus, even pain with exercise, and it's all made with high-quality, clean ingredients. I know there are a lot of CBD products out there, but CB Distillery is well known for their commitment to quality. 2 million satisfied customers and 100% money-back guarantee offered. If you're still struggling with sleep or stress, other health concern, not significant anxiety disorder or psychiatric illness, you can try something different like CBD from CB Distillery. I have 20% discount to get you started. Visit cbdistillery.com. Use code DREW for 20% off. That is cbdistillery.com. Code DREW, cbdistillery.com. Yes, I always like to emphasize that if there is something significant that is affecting your functioning, then that is, oh yeah, here's the prize. Susan took this last night. Affecting your functioning, then you need to talk to your physician about that and consider a mental health consult. Now, essentials, of course, we've been through a lot of government failures lately, whether it is lockdowns or not being able to contain fires or not, just not governing like we have in California. There's a lot. So Susan and I always have a bunch of the Paleo Valley snacks around. The protein sticks, of course, are at our fingertips. We have we have the beef, the chicken, the venison. They range in calories from 45 to 70. Look, this is a significant piece of protein and nutrients. Chicken are pasture raised. All 8 varieties are gluten-free, free of soy, dairy, gluten, no added sugars, no artificial nitrates or nitrites, no antibodies, no hormones, carefully sourced, non-GMO, naturally fermented. Go to doctor.com/Paleo Valley for a first-time order to get 15% off. 15% off. Subscriptions get you 20. That is doctor.com/Paleo Valley to save money and be prepared. Dr. Peter McCullough is here. And we were
skinny.
Yeah, Susan. Yeah, I know they're really a great nutrient source. They're very dense and low calorie. So, and high protein, obviously. So, Dr. Peter McCullough with us. The book is we haven't talked about the book at all this time, right? The COVID-19 book.
You know, the book's done really well, but, you know, we started writing it in 2021, came out in 2022. Now it's already kind of 3 years, a gripping narrative of what happened in the first phase of the pandemic. And so now we're on to other adventures. Courageous Discourse Substack is where I like people to go to, you know, get updated. All the citations I'll give through this interview and others, you can find them on Courageous Discourse Substack.
So now let's talk about clotting and cardiovascular update. You said you wanted to maybe Damar Hamlin. Susan's very interested in what happened to Damar Hamlin.
I didn't see him this year.
I think he played, but go ahead.
Well, let's just take the virus. So recall in 2020, there were no vaccines. So we had a full year to just observe the virus and what the virus did to the human body. And the Italians broke the news that the virus itself caused fatal blood clotting. This is very important. The virus causes fatal blood clotting. In fact, almost all those who die of COVID-19 after being in the hospital for weeks, there's blood clots in the lungs. That's the virus. There was a great concern among college athletes that the virus would damage the heart, so-called myocarditis. This is in 2020. So colleges had screening programs. The entire NCAA Big Ten Athletic League, that's University of Michigan, Ohio State, you know, those Big Ten schools, they had COVID-19 myocarditis screening programs, Dr. Drew. That means when athletes got COVID in 2020, no vaccine, they had cardiac troponins, EKGs, ultrasounds, and got triaged for cardiac MRI. And in a paper by Daniels and colleagues, Daniels published in JAMA, out of screening tens of thousands of athletes, they found about 36 putative cases of COVID viral myocarditis. No serious cases, no hospitalizations, no deaths. So it is possible that the virus causes myocarditis, but it's very rare. And the virus itself, in the best studies that exist, indicate that it's non-serious. A paper by Tuvali and colleagues from Israel found no increase in myocarditis above the baseline. Now we bring in the vaccines, and I went on Tucker Carlson about 24 hours after this event when Damar Hamlin went down. And I can tell you, he didn't go down because he tackled that player. Initially, the thought was maybe it was commotio cordis, and that can occur with a hockey puck or a baseball at about over 100 miles an hour hitting an unprotected sternum. In this case, the players have breastplate pads, and the helmet is diffuse, so it diffuses the energy. So it could not have been commotio cordis that caused Damar Hamlin to go down. He had a full-blown cardiac arrest. He was defibrillated, Dr. Drew. Now, he probably this was a kickoff. He probably just drank some Gatorade beforehand, because some of the clips show that he had fluid. He actually had a lot of fluid in his mouth when they were resuscitating him. He probably aspirated, and that's the reason why he was on the ventilator overnight. But a very interesting part of Damar Hamlin's story is, after they shocked him and they intubated him on the field, the paramedics pulled into the tunnel, and they stayed in the tunnel in the stadium for a very long time, about 15 to 20 minutes. Do you have any idea what was going on?
Did he rearrest, or did he, what you tell me, what do you know?
Well, listen, I knew somebody there at the game. We were texting, and I can tell you, when a patient's unstable, and I'm a cardiologist, I receive patients like this.
Yeah.
When they're unstable, the paramedics do not stop. They go lights and sirens as fast as they can, right? You know what they were doing? They were waiting to get his mom out of the stands. So you know what that told me? That told me he was rock stable. He had to have a stable blood pressure, a stable rhythm. He was intubated, but he was rock stable after he was resuscitated. They did a great job resuscitating him. And what we know is if the resuscitation is prompt and patients have a stable rhythm, heart rate, no obvious neurologic initial abnormalities, they're going to recover. So when I went on Tucker Carlson 24 hours later, I told Tucker Carlson, he's going to walk out of the hospital. He's going to be fine. And other people were saying, oh, he's brain dead. He's not going to make it, what have you. So the point I'm making is it's important when you go in the media to be right. And I knew I was right because, I had some accurate inside information. And it's great news for Damar Hamlin. He did recover. He never really stated if he took the vaccine or not. It looked like a vaccine cardiac arrest. He went on with Michael Strahan, and Michael Strahan asked him what caused the cardiac arrest, and Damar goes, "Oh, I don't want to talk about it." It looked like he was told not to say the vaccine. Later on, Hamlin tried to adopt the story that it was commotio cordis. But myself and retired cardiologist Michael Gutkin, we wrote the Buffalo Bills doctors. We wrote the Buffalo Evening News. We said, listen, it looks like a vaccine cardiac arrest. We hope he's getting proper treatment. I have these patients in my clinic. They need spike protein detoxification. That's with some natural supplements, but they need a critical drug called colchicine. Colchicine treats the myopericarditis. It stabilizes it. And in the peer-reviewed literature, believe it or not, once patients start on colchicine, they don't have recurrent myopericarditis and they don't have cardiac arrests. So this is a very important observation. If the MRIs check out okay, there's not a large segment of inflammation, the spike detoxification and colchicine is the way to go. And I know that the risk of repeat arrest is not the same as it is with other causes of cardiac arrest, because I had a chance to interview and examine Pilot Snow. Do you remember him?
Yeah. Vaguely.
You remember
Tell me
Pilot
more.
Snow? Yeah. He was the pilot, American Airlines pilot, who took the vaccine. He took Janssen, and he had a cardiac arrest about 6 weeks later on the jetway at DFW Airport after he landed a big airplane. And, everybody had left, and he was on the jetway, and there's actually a story written about him called The Miracle of Pilot Snow. And you know what the miracle was? Is as the remaining passengers and the flight attendants were trying to resuscitate him, you know how the pilots are kind of right there when saying goodbye to people? That's when he went down. Yeah. And Snow told me he went down like a rock. He went completely down. He doesn't remember anything, just going out. As they were scrambling to get the defibrillator, one of the flight attendants, who was very alert, she called 911. And there's 2 units at DFW Airport always circulating. The miracle of Pilot Snow was the paramedic unit happened to be at the gate next door. And DFW
Wow.
has 5 terminals. So by luck, that they were at the gate next door. They came right over. It took 6 defibrillatory attempts, 6 defibrillations to get Pilot Snow back. He did get a defibrillator, and I saw him about a year and a half later, and I asked him a very important question. Did you have your defibrillator go off again? He goes, it never went off again. And there's a USC basketball player, Nick Uichuchu. He almost certainly had a vaccine cardiac arrest too. He has a defibrillator like Snow, and to my knowledge, it has not gone off again. So the point is, the vaccine cardiac arrests are having a different profile than cardiac arrests due to heart failure or other causes. And it looks like, honestly, it's a treatable form. And so Hamlin, Susan asked, did Hamlin play? Well, when he had his cardiac arrest, it was towards the end, and he was out, for the next 6 months. He got in pads for the following season. They let him practice slightly. I think he played about 5 plays in the 2023 season. But 2024, he played. He actually got to the point where he started, and he was able to contribute. He made some interceptions. He made some key plays. So Damar Hamlin is a happy story. I think is likely he took the vaccine. He had a cardiac arrest, and now he's recovering. I wish he would come clean, spend some time with me and other cardiologists, tell everybody what happened so we can actually help others in his situation, because maybe in this case the defibrillator is not needed. Maybe medical treatment can allow the safe course and a safe trajectory. So it may not be all bad news for those who took the vaccine, but this lack of honesty on Hamlin's part and his doctors is really hampering this. He could be a really important story.
And I want to believe that we're entering a phase now when people can speak the truth, frankly, once again, as the First Amendment seems to go back into position where it has always belonged. But it makes me, when you think about it, so a focal myocarditis that becomes a source of abnormal rhythm will resolve, right? Unless it's a diffuse myocarditis and they develop a cardiomyopathy, which is what I was always worried about, but we're not seeing that. So, when people get sudden cardiac death, it's usually ischemic, meaning blood supply is cut off, or myopathy of some type. But a transient local inflammatory myopathy is very dangerous when you have it, but once it passes, that's the end of that.
Right. You got that. That's exactly right. And so the spike detoxification occurs with nattokinase, bromelain, and curcumin. We have preclinical data with 2 of the compounds and randomized trials with the third. That has a salutary effect. Wellness Company has Ultimate Spike Detox. One can buy the components separately. And then the importance is colchicine. I can't emphasize this enough. Colchicine is used for gout. It's a special anti-inflammatory drug. It's derived from the petals of a purple flower, so the pill is purple. But it's so beneficial. It's mandatory in any form of myopericarditis. Mandatory. It's in the guidelines. And now, Dr. Drew, in 2023, the FDA broadened the use of colchicine as indication to prevent heart disease in general, atherosclerotic cardiovascular disease, based on 3 randomized trials. So it has an indication like a statin. It has an indication like a statin, but it's not a statin, and it doesn't lower cholesterol. It works by lowering inflammation in the heart.
What kind of dosing?
Just 1 pill a day, 0.6 milligrams a day. When it's twice a day, there is some GI upset, but at once a day, it's very well tolerated, and that's the dose we use in patients with these COVID-19 myopericarditis and these pleuritis, these chest syndromes. I liberally prescribe it because it's safe, and I want to make sure my patients are covered. I don't want to see anybody else get burned with a cardiac arrest.
I didn't notice that in the encyclical that TWC is preparing. We may want to put, I wondered if they wanted to put something about pharmacological agents in there, because there are some useful pharmacological agents in these situations. And they're pennies. These are old-timey treatments, So, and now my also understanding that over 80,000 experts and physicians have signed some sort of document asking for mRNA recall. What's the status of that? What's going on there?
Well, McCullough Foundation, which is my charitable foundation, has summarized this in the journal Science, Public Health Policy, and the Law with Dr. Mary Telly Bowden. Everybody should follow her. She's been on social media. And we summarized all the calls to pull the vaccines off the market. Professional organizations like the World Council for Health and Association of American Physicians and Surgeons, lawmakers, Florida Surgeon General Joe Ladapo. The point of this paper is that the chorus of calls to remove COVID-19 vaccines from the market is growing. Remember, the pandemic is winding down, so we don't have strong clinical indications or medical necessity. And the safety of the vaccines has always been an issue, including excess death. In this paper, there's an evidence table now. We have a dozen studies showing that the COVID-19 vaccines are associated with an increased mortality, not a decrease in mortality.
Yeah, this is, and now we can start to look at these things honestly and carefully, and do the usual back and forth through the medical literature, where somebody will disagree strongly with this and have an alternative position, and we'll see, and we will eventually get to the truth. Right now, it's very, very concerning. What are you showing me there? It's please ask Dr. McCullough about. I understand why I would do that.
Okay.
Okay. Something about phosphates, kidney disease, and heart disease. Is that an early paper you published before COVID or since COVID?
Yeah, I've had a great interest in how kidney disease contributes to cardiovascular disease, and indeed it does. And I would just say parenthetically, we're presented with quite a proposition right now, and you and I have talked about it off camera. And that is the widespread use of GLP-1 receptor agonists, like Ozempic-like drugs. And, they are now, there's a paper out in JAMA indicating that, half of the nation would have an indication for one of these drugs. And, I use them very selectively. But I do have to tell you, there are positive data for both kidney and heart outcomes using these drugs. Of course.
If it's proper medicine, the proper patient, proper treatment, better outcomes. It's just the widespread, indiscriminate use of anything that how you harm people. And it's every case has got to be evaluated in the context of the potential reward and the potential risks to that patient in the context of their socio-historical, ethical, religious, family, all that has to be taken into consideration. We've gotten into this weird phase where everybody has to get everything the same. It just doesn't work like that in medicine.
Right. Yeah, I couldn't agree more. If we've learned anything from the pandemic, we have to individualize. What's coming out of these Senate hearings is, people want to make their own choices. They don't want to be presented with a mandate of any type. And, Robert F. Kennedy and DHS, they're not going to take away medicines or vaccines, but they probably will advocate for medical freedom.
I think that's true. Let's leave it there, Dr. McCullough. We appreciate, as always, as being here. What's that, Susan? Get on your mic.
I said, let's hope so.
There's no doubt in my mind. I don't agree with everything RFK, as I've told him to his face. I don't agree with everything he advocates for or believes to be true. I'm not sure I believe everything Dr. McCullough believes to be true, nor should he believe everything I believe to be true. This is how it works. But I believe he is the right man for the job at this moment, which is about dismantling these adulterating influences on not just our regulatory system, but our very government. And it's not pretty. That's what we're seeing. Dr. McCullough, thank you so much for being here, and I look forward to seeing you again soon.
See you soon.
Appreciate
Thank
it.
you.